Hi everybody, I am Dr. Pradeep Kumar Shenoy, consultant rheumatologist at Amrita Multi-Specialty Clinic, Attawar, Mangalore. This is the first rheumatology clinic of Dakshina Kannada and Udupi district of Karnataka. In this video, we will look into pathogenesis of rheumatoid arthritis and osteoarthritis in a simpler manner. To explain both rheumatoid arthritis and osteoarthritis, I have taken knee joint as the prototype of synovial joints because it has got all components of a synovial joint. It has got articular bones, which are femur, tibia, and femula, and patella. It has got a joint cavity, huge joint cavity, and it has got an articular cartilage. It has got a capsule which has got an inner lining of synovial membrane. So knee joint is a perfect joint to explain the pathogenesis of both rheumatoid arthritis and osteoarthritis. We will come into osteoarthritis first. If we look into the osteopathogenesis of cartilage, there are two elements. One is chondrocytes and other one is extracellular matrix. Extracellular matrix is secreted by chondrocytes. Now, let us look into the components of extracellular matrix. They are type 2 collagen, hyaluronan, chondroitin sulfate, cartilage oligomeric protein, proteoglycan, etc. These are the components of extracellular matrix. If there is a defective gene coding for any of the defective extracellular component, then that patient is prone for osteoarthritis. Now, other etiological factors for osteoarthritis are age, sex, and obesity. At the age of 55, a lady would develop osteoarthritis because a lady will always have a thinner cartilage than a gentleman, as well as her estrogen level goes down. Decreased estrogen levels are also mentioned in the etiology of primary osteoarthritis. Coming to obesity, prolonged excess weight bearing in a man or woman would rapidly degenerate the articular cartilage. Now, the question is articular cartilage is avascular and aneural. So, why the pain is perceived by the patient? There are some mechanisms to explain this. When the articular cartilage degrades, after some time, underlying subchondral bone is exposed to tension from above. This produces mechanical stretch and that produces pain in the subchondral bone which is perceived by the patient. Now, when there is degeneration of the articular cartilage, the alignment of the joint gets disturbed. To correct this, body tries desperately, and at the margin of the joint, the body produces a bony proliferation. This bony proliferation is called as osteophyte. If the osteophyte irritates a nerve, then the patient feels the pain. And the ligaments and tendons which are attached to the knee joint also feel stretched when there is malalignment. This also produces pain, and this is perceived by the patient. And the bursae associated with the knee joint, they are also mechanically challenged when there is a derangement of the bones. They, this produces bursitis, and this bursitis also contributes to the pain. Though the articular cartilage is avascular and aneural, the patient with primary osteoarthritis perceives pain because of all these reasons. Now, coming to the rheumatoid arthritis, the risk factors for rheumatoid arthritis are being a woman, genes like HLA, DR1, DR4, and shared epitopes, and environmental factors like smoking. Before going into the etiopathogenesis of rheumatoid arthritis, let's just look into the histology of synovium. Synovium has got two types of cells, type A and type B. Type A is macrophage-like and type B is fibroblast-like cells. The key signature cytokine of rheumatoid arthritis is TNF alpha. Under the influence of TNF alpha, type B synovial fibroblast undergo proliferation, and from the inner layer of the capsule, they come onto the surface of the articular cartilage. Normally, articular cartilage is not covered by synovial membrane. This synovial membrane, when it reaches the articular cartilage, like a sheath, it is called as pannus. This pannus produces matrix metalloproteinases like a collagenase, gelatinase, stromatolysine, etc., which degrades the cartilage. The cause of pain in inflammatory arthritis per se is inflammation, but there is one problem with the inflammatory joint because the synovium is present in many places. It covers the tendons, ligaments, etc. So, when there is an inflammatory arthritis, wherever there is synovium, they all undergo inflammation. For example, superior and inferior articular facet joints of the vertebrae, subtalar joints, and ossicular joints in the ear, they all undergo inflammation. So rheumatoid arthritis is not what we see clinically, a lady with a deformed hand. It has got lot of underlying inflammation as well. I would like to say that the primary pathology in osteoarthritis lies in cartilage, but in inflammatory arthritis, the primary pathology lies in the synovium. There are other joints which undergo primary osteoarthritis like hip and the distal interphalangeal joints of the hand. And recently, there are evidences that chemokines, growth factors, neuropeptides, etc., are taking part in the pathogenesis of osteoarthritis. Probably these molecules will be targeted in future to treat this illness. The treatment of rheumatoid arthritis, combination chemotherapy, I have discussed in my previous lectures. So the key message is degenerative arthritis is because of degeneration in the articular cartilage, and inflammatory arthritis is because of the proliferation of type B synovial fibroblast in the synovium. Thank you.